Hello everyone, welcome to USMLE Step 1 Biochemistry lectures. In this lecture, we will talk about vitamin D. Remember, vitamin D is a fat-soluble vitamin. But most importantly, vitamin D is not a vitamin, but it is mostly a hormone. Because vitamin D is important in the regulation of calcium absorption and also is helpful for calcium homeostasis. For the vitamin D to be formed, what is the most important thing? It is the sunlight that needs to be formed, because sunlight, whenever it hits the skin, vitamin D is formed. Why is this important? Because most of the people who lives in cold countries do not have sunlight, so they usually develop tiredness, fatigue by the end of the day, which is related to vitamin D. The incidence of multiple sclerosis increases in vitamin D deficient individuals. If you talk about the function of vitamin D, it is the calcium absorption and maintenance of calcium homeostasis that is important. But vitamin D is also important for cell differentiation, cell proliferation, bone mineralization, and immune regulation. Alright. If you can remember this, you will understand the functions of vitamin D and also what happens when vitamin D is deficient. Alright. Sometimes they can also tell you that intake of the vitamin D usually reduces insulin resistance. This is one new concept that has been tested. So concept of insulin resistance decreases whenever there is vitamin D intake. Alright. Deficiency of vitamin D leads to rickets in children and osteomalacia in adults. Alright. Now we'll talk about the vitamin D synthesis in the skin. Remember, when we talk about vitamin D synthesis, we will have to remember one of the important flowchart. What is it? It is the cholesterol, which is converted to 7-dehydrocholesterol, and this on sun exposure is usually converted to vitamin D3. In the diet, the form of vitamin D which is present in the diet is D2 and also D3. Alright. This D2 is called as ergocalciferol, whereas D3 is called as cholecalciferol. Alright. By the action of 25-hydroxylase on both of these, it will form 25-hydroxycholecalciferol, that is D3. Now, the 25-hydroxycholecalciferol is acted upon by 1-alpha-hydroxylase. This is present in kidney. This is what the examiner is going to ask you. It leads to the formation of 125-dihydroxycholecalciferol, which is the active form of vitamin D. Now, whenever the patient has got renal failure or renal injury, what happens is patient with renal failure has got decreased activity of 1-alpha-hydroxylase. That leads to the decreased formation of 125-dihydroxy vitamin D3. That is why patients with CKD or chronic kidney disease have got vitamin D deficiency. This 125-dihydroxy vitamin D3 usually acts on three important structures, that is bone, one is intestine, and another one is renal tubular cells. Alright. On the bone, it increases calcium absorption and increases phosphate release. Whereas in the intestine, it increases the absorption of calcium and phosphate. Whereas in the renal tubular cells, it is involved in the reabsorption of calcium and also phosphate. Whereas in the urine, it causes decreased calcium and decreased phosphate. All these contribute to increase in the calcium and increase in phosphate. This is what you will have to understand. And this is what the examiner is going to test you. But we'll go a bit more detail and see what exactly happens. Alright. Vitamin D, the synthesis usually begins from 7-dehydrocholesterol. Alright. This is usually formed from cholesterol. And this is an intermediate in cholesterol synthesis. This 7-dehydrocholesterol accumulates in the skin. And when the skin is exposed to ultraviolet rays, the 7-dehydrocholesterol is converted to cholecalciferol, that is D3. This is a non-enzymatic reaction. You'll have to remember this. This is a non-enzymatic reaction. What happens after the cholecalciferol is formed? The cholecalciferol is absorbed in the blood. So, the vitamin D, vitamin D3 levels are dependent on the UV light, that is sunlight. So, the examiner can tell you that whenever there is sunlight that is increased, vitamin D3 levels are increased. Whenever the sunlight levels are decreased, vitamin D3 levels are decreased. This is why the patients who live in cold countries or no sunlight countries will have decreased cholecalciferol. If you talk about the sources of vitamin D3, it is the sun, that is one important thing, the fish and the milk. Alright, whereas vitamin D2, it is usually from the plants, fungi and yeast. Alright, now the D2 and D3, as we have seen, they are converted to 25-hydroxy vitamin D3 and then the 125-dihydroxy vitamin D3, and then this is called as calcitriol. But what exactly happens when there is renal failure? It is the absence of 1-alpha hydroxylase which impairs the formation of 125-dihydroxy vitamin D3, that is calcitriol. This is calcitriol. Alright. Now, there is something called vitamin D binding globulin. Remember, the circulatory form of vitamin D is calcidiol. This is a major circulating form and in the storage form of vitamin D. Alright. Now, how is the vitamin D metabolism regulated? The regulation of vitamin D is basically to control the calcium levels. The main function of vitamin D is to increase the calcium levels in the blood. If there is a low calcium, what happens? Or if there is low phosphate, what happens? Whenever there is low calcium or low phosphate, it stimulates the parathyroid hormone. So, parathyroid hormone increases. And this parathyroid hormone stimulates 1-alpha hydroxylase in the kidney. That results in the formation of 125-dihydroxy vitamin D3. So, it results in the increase in the calcium and decrease in the phosphate. Alright. But there is also something called as feedback inhibition. What is feedback inhibition? The calcitriol, that is 125-dihydroxy vitamin D3, this is also called as calcitriol. Calcitriol reduces its synthesis by inducing 24-hydroxylase. Whenever the 24-hydroxylase is induced, it represses or it reduces the activity of 1-alpha hydroxylase. This is very important. Parathyroid hormone promotes the activity of 1-alpha hydroxylase, whereas the calcitriol usually decreases the activity of 1-alpha hydroxylase. Now, if you see the actions of vitamin D3, we've already seen in the intestine. In the intestine, what happens? It increases the calcium and it increases the phosphate absorption as well. Whereas in the kidney, it increases the calcium reabsorption in the renal distal tubules. Whereas the parathyroid hormone, it is a phosphate trashing hormone, so it decreases the phosphate. Alright, in the urine, the vitamin D3, what does it do? Vitamin D3 in the urine, it decreases the calcium because most of the calcium is absorbed in the renal tubular cells. Alright, this is interesting. What happens whenever there is vitamin D3 action on the bone? At low levels, what happens is, it helps bone mineralization. Whereas at higher levels, it increases bone resorption. Alright, what are the other functions of calcitriol? One important function, recently identified function, is insulin resistance. Whenever there is good vitamin D amount, it prevents insulin resistance. How does it do? Because it increases the insulin secretion. Alright, and it also inhibits the interleukin production, which is by the activated T lymphocytes. Alright, it also has got immunoglobulin production by B lymphocytes. This is very important. Alright, this is why vitamin D is important. Now, if we talk about vitamin D deficiency, the vitamin D deficiency in children, it causes rickets. What happens in rickets? It is the under mineralization, decreased mineralization of the bone that happens, and this happens because of the poor calcium absorption, and the patients can have bone deformities. They have bow legs. If you talk in medical terms, it is genuvarum, and there is delayed growth. Because of the low calcium, the patients can also develop tetany. Alright, most importantly, rickets is because of malabsorption and reduced sun exposure. Alright, there can be poor diet, malnutrition, chronic kidney disease, and advanced liver disorders as well. Now, we talk about the vitamin D deficiency in adults. In adults, vitamin D deficiency usually leads to osteomalacia. And osteomalacia, the bone becomes demineralized. So, it causes bone pain and muscle weakness. Usually, osteomalacia is seen in elderly people or elder patients, decreased sunlight, patient who have got multiple pregnancies, malabsorption, chronic kidney disease, and advanced liver disease. Alright, now we talk something important that is called as vitamin D toxicity. The vitamin D toxicity, what happens in vitamin D toxicity? Some of the infants who have got excessive sensitivity to vitamin D usually leads to toxicity. Alright, and this toxicity can lead to increased calcium which is present in the blood. Because of this increased calcium, there can be calcification of soft tissues. Alright, what happens? Vitamin D toxicity is basically because of the excessive intake. Sometimes there can be a defect in 24-hydroxylase as well. If there is a 24-hydroxylase deficiency, it usually causes hypercalcemia. Alright. So, this is all about vitamin D3. Please do remember, this is an important concept. Listen to the video again. I'll see you in the next session. I wish you all the best.